Hello, Dazzle. Thanks for coming and hanging out with me today. I am glad that you are here. Today, I'm going to be talking about a habit that many of us struggle with: nail biting. Whether you have been biting your nails for years or just can't seem to stop when you're stressed, this video is for you. We'll explore what nail biting is, why it happens, the consequences it can have on your health, and most importantly, how you can break the habit for good. So let's dive into the journey of overcoming nail biting and reclaiming those nails. Nail biting is medically known as onkophagia. It's a chronic compulsive habit where a person bites their fingernails or toenails, and it's often linked to stress or anxiety and can start at any age, affecting both children and adults. Many people use nail biting as a way to cope with nervousness, boredom, or even hunger. But for others, it becomes a deeply ingrained habit that's difficult to break. While nail biting is commonly viewed as a minor nuisance, it can be part of a larger behavioral and mental health challenge. According to the DSM 5, body focused repetitive behaviors, or BFRB, are classified as obsessive compulsive related disorders. These behaviors include hair pulling, skin picking, and nail biting, among others. While these behaviors can often start as common habits, they become pathological when performed frequently despite a desire to stop. They cause physical harm, they cause distress, or they're causing a functional impairment. Nail biting, like other BFRBs, crosses into problematic territory when it continues despite negative consequences, becoming difficult to control and affecting overall well being. BRFBs are habits where a person unconsciously damages their body by engaging in repetitive actions like hair pulling or skin picking. Nail biting is one of the most common, and experts estimate that around 30% of children and 15% of adults engage in nail biting. Interestingly, though, most individuals stop biting their nails by the age of 30, and this is often because that they naturally outgrow the habit or they find other coping mechanisms. Though nail biting may seem harmless, it can have both physical and mental consequences. And so let's look at some of those outcomes for chronic nail biting. So you can end up with dental problems. Regular nail biting can cause chipping or notching of the teeth. It can cause gum inflammation and even reshaping of the teeth. Severe cases can lead to temporal mandibular disorders, which affect jaw movement and can cause pain. So, nail biting can also lead to infection. Biting your nails introduces bacteria and germs from your hands directly into your mouth, which can lead to infections in your mouth and body. The broken skin around your nails is also much more vulnerable to infection. Nail biting damages your nails. Prolonged nail biting can damage the nail bed, the surrounding skin, and the nails themselves. In severe cases, the nails can stop growing altogether, or you can experience long term deformities. Biting your nails can also affect your mental health. Beyond physical consequences, nail biting can also be a sign of deeper emotional or psychological distress. It's often linked to low self esteem and anxiety. People who bite their nails may feel embarrassed or self conscious about the habit, which can increase anxiety and affect their social interactions. So, how do we stop biting our nails? Breaking the habit of nail biting is challenging, but it's not impossible. So, let's look at some strategies that have been shown to help. So, the first is psychotherapy. Cognitive behavioral therapy, or CBT, is highly effective in treating compulsive behaviors, including nail biting. CBT helps individuals identify triggers and develop healthier ways to cope. Medications. In some cases, medications may be prescribed to help manage the underlying anxiety or stress that leads to the nail biting in the first place. Keep your hands busy. Keeping your hands occupied with activities like squeezing a stress ball or playing with a fidget spinner can help redirect the urge to bite your nails. Bitter nail polish. Applying a bitter tasting nail polish can discourage you from putting your nails in your mouth or just serve as a tool to help you become aware that you are nail biting, giving you the opportunity to make a choice rather than passively engaging in routine behavior. Proper nail hygiene. Keeping your nails clean, trimmed, and well maintained can reduce the urge to bite your nails. Regular manicures can also make biting less appealing. Identifying triggers. Pay attention to situations or feelings that prompt your nail biting and develop alternative coping mechanisms for these moments, such as deep breathing or engaging in a hobby. Hobbies to keep your hands busy are especially helpful. Use nail covers. Covering your nails with bandages or wearing gloves can prevent access to your nails and reduce the chance of nail biting. Behavioral therapy. Professional therapy focusing on behavioral techniques like habit reversal training can help you gradually replace nail biting with healthier habits. So, which of these techniques work the best? So, research shows that cognitive behavioral therapy, or CBT, is the most effective method for overcoming nail biting. CBT helps individuals identify triggers, understand the root cause of their behavior, and develop healthier alternatives. By addressing the underlying anxiety or stress, CBT not only helps people stop nail biting, but it gives them long term coping strategies that can prevent future relapses. That being said, nothing is guaranteed, and this doesn't work for everyone. Relapsing is common when it comes to quitting nail biting. Many individuals looking to break the habit find themselves struggling, and a significant number fail in their initial attempts. The risk of relapse for recovered nail biters is really high, making it crucial to recognize that setbacks are a normal part of the process. This needs to be accounted for when people embark on the journey of overcoming nail biting so that the possibility of relapse can be accommodated into the plan itself. Understanding that it might take several tries to quit can help individuals approach that habit with more patience and persistence. However, maintaining positive attention to your nails can help keep the habit at bay. Regular manicures or applying a nail polish, especially one that you enjoy, can act as a reward for keeping your nails intact. The polish also serves as a visual reminder not to bite. Focusing on keeping your nails healthy and clean can also reduce the desire to engage in nail biting. And while there's no perfect solution, keeping your hands busy and managing stress in healthy ways can significantly reduce the chances of relapse. Nail biting is more than just a minor habit. For many, it's a compulsive behavior tied to deeper emotional and psychological issues. Though it often begins as a coping mechanism for stress, boredom, or anxiety, it can escalate into a chronic condition that's significant physical and mental consequences. The good news is that with the right strategies, such as behavioral therapy, identifying triggers, and adopting healthier habits, nail biting can be successfully managed and even stopped. It's important to recognize that setbacks are common, but with patience, persistence, and a focus on self care, overcoming the habit is absolutely possible. Quitting nail biting is not an overnight process, but a gradual journey toward healthier habits and a greater sense of self control. Well, that's about it for my rambling today. Thanks for coming and spending some time with me. If you like my rambling, then click on that like button because it really does help. And until we can talk again, you guys be sure to take care of yourselves. Bye.